Welcome to the Ketones and Coffee Podcast with Lawrence Manaig, where we explore the ketogenic lifestyle and how it can improve your physical and mental health. Each week, we bring you valuable insights and advice from experts to help you on your journey to a healthier lifestyle. This episode is brought to you by BasicKetogenicLifestyle.com, where Lawrence coaches individuals with depression to reverse their symptoms and achieve a healthier, happier life using an evidence-based approach. So sit back, relax, and join us as we dive deep into the world of ketones and coffee. Subscribe to the Ketones and Coffee Podcast today and never miss an episode.
I'm so excited for this. We have a very special guest on the podcast today. Beth Zupec-Kania is a registered dietitian and a nutritional ketosis expert with 40 years of experience in promoting safe and effective ketogenic metabolic therapies. Beth has authored multiple medical publications and education guides, co-organized 3 global ketogenic symposiums, and speak at conferences internationally. Beth is also the designer of Keto Diet Calculator, a web-based program for calculating ketogenic diet. She is the primary author of Ketogenic Diet Therapies for Neurological Disorders, a pocket guide, which is now in its 4th edition. She is also the primary consultant to the Charlie Foundation for Ketogenic Therapies, providing information about diet therapies for people with epilepsy, other neurological disorders, and select cancers. Beth, welcome to the show.
Thank you, Lawrence.
Beth, it's a pleasure to have you on the show. We were talking about it earlier about your advocacy for ketogenic metabolic therapies is truly inspiring. And, you know, what inspired me and what's impressive is that you've trained over 300 medical centers worldwide. That's a feat. And 40 years in the field. So I guess my question for you, first question to start off. So what continues to motivate you and to advance this work and share that message to the world?
You know, I have to go back to my early beginnings as a nutritionist, and I realized quite quickly that people really weren't interested, or maybe they were interested, but they weren't successful in changing their diets because they really didn't get very good results. And when I started working with keto and we were seeing results in a few days, and my first patients were people with epilepsy, and to see people really turn around in a couple of days who did not respond to traditional therapy, it was usually medications that didn't work for them or made them feel horrible. But in a few days of being in ketosis on a well-formulated ketogenic diet, so I'm going to highlight that terminology because you can be on a bad ketogenic diet too, but within a few days, to see them become brighter, more alert, seizures start to melt away, I was hooked. I just thought, this is incredible. This is a really powerful therapy, and I really wanted to become better at it so that I could serve as many people as possible.
Yeah, you can almost not unsee it, right? When you see such incredible things happen to an individual that, you know, is almost desperately looking for a cure. The same thing happened to me on the ketogenic diet, reduced my symptoms of depression, which is only takes that one time to see that effect, and you're hooked, like you said. I want to start by just acknowledging, you know, the incredible impact you've had on families, you know, dealing with epilepsy and other metabolic syndrome. And like you said before we started, it's truly a miracle work. Like, it's truly heroic for me because these families are looking for ways to cure, maybe a daughter, maybe a son that is struggling with epilepsy. That being said, I understand that, you know, spreading awareness about the benefits of the ketogenic metabolic therapies can be, you know, a frustrating process sometimes, especially on your speak on multiple occasions. You talked about it being underutilized, right? We'll get to that topic in a second. But first, you know, your backstory. I want to hear your story and how you first encountered keto, and you talked about it a little bit earlier. And you know, the ketogenic diet is, for me, it's still unconventional treatment because it can still raise skepticism, right? Given our traditional conditioning and training, can you share a little bit about that first encounter with the ketogenic diet, and how did you feel about it? Why were you hooked, like you said, and what inspired you to, keep pursuing this field, even though it's been many, many years and it's still driving you to push the message forward?
Yeah, so first I want to start out by saying ketogenic diet therapy is 103 years old. So it's been around for a really long time. And so it has this huge history of being highly successful for mitigating epilepsy and mitigating difficult to control epilepsy. And it doesn't work in all cases, but the rate of epilepsy remission is quite high, especially in children. If you get people while they're young in their life, while they're young in their course of epilepsy. So I have to give credit to Jim and Nancy Abrams, who started up the Charlie Foundation, because they, as young parents, would not take, "we don't have anything else for you, for your child," as an answer. Jim Abrams was told that we've tried all of the drugs for your child. We tried a brain surgery. There really isn't anything else for you available. So just, you need to prepare yourself for a child who will have a lifetime of disability. And Jim went to the UCLA Medical Library and started reading books and trying to find another solution. And he came across a book with a chapter about the ketogenic diet. And he took that book to his child's doctor and he said, "What about this?" And his doctor said, "Well, we don't do that here in California." And Jim said, "Where do they do this?" And he said, "Johns Hopkins." So long story short, Jim and his wife packed up Charlie, got him on a plane, went out to Hopkins. They admitted him, put him on keto, and within a few days, his seizures just started to melt away, basically. And within 2 weeks, he was seizure-free completely.
Wow.
Now, Charlie's in his early 30s, and he's been off the diet since he was 5. So for children, we just use the diet for a few years, and then they can go back to eating whatever they want. So he's been off the diet, doesn't even remember being on it, but he's been seizure-free since that point in time. And this is what motivated the Abrams to start up a nonprofit to inform other parents about this option, because it was really in the closet, even though it was created in 1923. It's been in the closet for all these years, hardly used, because it's so much easier for doctors to write a prescription or do a scheduled epilepsy surgery than it is to take the time, explain what the ketogenic diet is, find a dietitian, get her trained, him or her. So that's the sad story, and that's why it is underutilized even today, with all the science behind it, the randomized controlled trials, there are several proving its efficacy. It is still underutilized here in our country and basically around the world for epilepsy and other disorders. We can talk about other disorders, but for epilepsy, we know it's effective. No one can deny the science. It still is not offered where it should be.
I came across this video I went on the Charlie Foundation website about how Charlie's parents found, that story, that book, right? About the ketogenic therapy for epilepsy, and maybe out of, your desperation, right? Nothing has worked, and no conventional treatment has worked to that point. And you talked about the doctor being almost dismissive, right? Since they've done everything. In the video, Charlie's doctor was asked why hadn't he brought up the possibility of ketogenic diet therapy earlier, since they don't do it there, but he hasn't mentioned of it. He said, quote, "Well, I don't think we had exhausted all the medical approaches yet. There were still actually other medications we haven't tried yet." And that's disheartening to hear for families and that had to go through this, right? Since the video was made years ago, can you share with us any changes that have been made in terms of awareness and implementation of ketogenic diet therapy as treatment option for families?
Yes. So that doctor is still alive. He's now retired. And if you would talk to him today, he would say, well, now I know that there's 6 randomized controlled trials. I have to tell my patients about this because there's proof. He didn't have that evidence when he made that statement. So, to give him a little bit of break, he was following what doctors are supposed to follow. And there's all kinds of quackery we know in the medical field, and doctors have to follow the golden standard, which is a randomized controlled trial. So now there's no excuse for any physician, not to say, I would even say it's malpractice for a doctor not to provide it as an option. And that's written in consensus guidelines that are published, which say after you try 2 anti-seizure medications and they don't work, this is when you should consider the ketogenic diet, because the statistics are for every subsequent medication that you try, the likelihood of them helping is less and less. I mean, it's less than 1% after the 3rd one. So anybody out there that has epilepsy, you have the right to request ketogenic diet therapy as an option. Now, I'm going to say request because there's a little bit of screening that is involved, and this is why we recommend you go to a center that has done this before and not just try it on your own, for example, or even try it with a doctor who has never done it.
And I apologize to that doctor. And that video was years ago. And he mentioned something on this same video. He mentioned something really interesting. And he was asked why modern doctors are ignoring the diet. And he replied, because there was no big drug company behind it. And and probably can never be unless someone markets sausages and eggs, he said.
Yeah.
And now you...
It's true, right? There's truth to that. That's a very sad statement of a lot of our healthcare options. Doctors don't make money on ketogenic diet. There's no billing code for a ketogenic diet. There's a billing code for drugs, but not for keto. So they're not making money on this.
And go ahead, sorry.
No, go ahead.
Yeah, and then you talked about now we have 6 randomized controlled trials, which is the gold standard to proving effectiveness, right? So it seems that many doctors are still not knowledgeable about this, and because I've interviewed several medical professionals on this show who have admitted that training to treat metabolic syndrome was inadequate for them. What efforts are being made to educate doctors now and create that awareness for keto?
So I'm involved with several organizations in that effort. So for neurological disorders, there's a new society called INCS, International Neurologic Ketogenic Society, and they have a conference every other year. This coming one is in September in San Diego, and it's a professionals conference. We also have a family day, but it's intended to bring people together, to researchers, physicians, nutritionists, nurses, and then for the family day, patients and their families. But bringing people together, letting them know what the current research is about, and then all the intricacies of ketogenic diet therapy. We feed them options of keto therapy, so the menu is representing what we're teaching. So that's a big conference. I'm also involved with a program in Europe called Keto Live, and they are creating a center for professionals to come to learn alongside patients who are coming to be started on ketogenic and low carb therapy. So that's called Keto Live. And their conference, they have a big conference every year, is in June in Switzerland. I'm also involved with the Bazuki Foundation, who is very progressive in getting the word out on keto for psychiatric disorders. And you've already talked about Matt Bazuki. You've interviewed him, right? So it's his family's foundation that is organizing professionals to train those that are experienced, like myself, to train other professionals on this therapy so we can get the word out. And that project is rapid fire. I mean, they are moving ahead, even without the randomized controlled trials, because a lot of people can't wait. Like if you were told, Lorenz, oh, there's this ketogenic diet. The results of the research should be ready about 4 or 5 years. Can you just kind of hang out there for a while, about 4 or 5 years? I mean, you could be dead by then, right? We can't wait. People cannot wait. And that's what happened to the Charlie Foundation. They could not wait for the science. They were told there isn't science. And they're like, when will this be ready? We want to try this now. We'll accept the risks. We'll try it now. And that's what they did. They accepted the small risks, which are far less concerning than the risks of medications. When it's done well, right?
Yeah.
And they went to a place, Johns Hopkins, who had been doing it for years and knew how to do it well, knew how to do it with real food, not processed food, knew how to do it with the right types of fats. So on a well-formulated diet, Charlie became seizure-free in a very short period of time.
Yeah, I saw one of your presentation at the Keto Live project. You mentioned, some, not all hospitals uses it.
Yeah.
And in your many years in the field, what has been most challenging in terms of just getting this treatment as a standard care for children with epilepsy?
Yeah, so I've gone into, as you said, over 300 hospitals around the world, most in the US, but I've been to Canada and several countries, even developing countries. And the major roadblock is getting a team of people to work together. So nutritionists typically don't work with neurologists. So getting those two to work together and including a nurse who is the main interface usually with those patients, and then maybe a social worker that a lot of hospitals don't even have anymore. But there is a core team, and the hospitals that are really successful do have those teams, and those are the ones that have a dedicated nutritionist who only does keto. So these tend to be the major academic hospitals that are in the big cities, New York, Chicago, San Francisco, Los Angeles. They all have more than one hospital that does the diet. I think Los Angeles has 5 hospitals, children's hospitals, and they all have keto programs. And they've been doing it since the Charlie story because Charlie lived in the neighborhood and they wanted to, get this out to the people because people were demanding it. It was a very grassroots effort because the Abrams went on Dateline and exposed their story. And that brought a lot of attention. And they got thousands of letters from people all over the world saying, how did they get this? Where did they go? And so that's why the Charlie Foundation became an advocacy foundation and education as well. And so they've supported me in that effort. And I left a hospital job doing keto for epilepsy to work on training others around the world. And I still have a private practice. I work with people that have very rare genetic metabolic disorders because they have no place to go, basically. And I've gotten comfortable with that. So I have a very small private practice working with those folks on keto, but also I have a training program myself for nutritionists with Denise Potter, who happens to be the dietitian that worked with Matt Bazuki. So it's a very small world of us because this is in the early stage of evolution, right? In getting this therapy out. And as I mentioned, for psychiatric disorders, we are moving faster than any other condition in getting the word out. So it's really cool to be involved in that.
I'm glad that there's a lot of support that's coming through for you guys. You mentioned the Bazuki family being progressive with this, and the Charlie Foundation, started it a long time ago, but now you guys have done a lot of work. You talked about 300 medical centers, and it's great to hear, right? But is it actually now, the standard care hasn't changed, has it? Has it been mainstream yet, do you think?
No, not yet. It's mainstream for people that are curious about it. You can go on Google and find all kinds of information.
Yeah.
And you mentioned this is not a reliable place to get your information because you actually get a lot of bad information and then a lot of very negative commentary on keto because people aren't using it the right way when they're doing it on their own. So that doesn't help the effort. But the good news is that the scientists are working on animal science and the clinicians are working on people science. So those are moving forward. And again, this is why these conferences, these biannual conferences, are so helpful, because the researchers talk to each other and they come out with better ideas on what to study. And so it is moving forward, but it is a snail's pace. Yeah. It's not like new drug development, which is much quicker, right?
For something so miraculous, it's slow progressing, right?
Yes.
You would think that this would have been mainstream now after 30 years, right? Just this changing people's lives. You would think people would know about this by now.
Yeah. You know, and
it's funny.
My bias is that I've noticed that the younger doctors, the ones coming into practice now, are far more interested than the ones that are getting ready to retire.
Yeah, they're far more receptive.
Yeah, the ones that are getting ready for retirement have so much wisdom.
Yep.
But they just don't want to take on, you know, a new therapy.
That's good.
Yeah.
That's good.
So it's an evolving process. And then, of course, any person, any physician or nutritionist who has seen not only a patient, but more importantly, a loved one do better, they're on board and they are, you know, very much supporting getting this out. I've seen that many times. It's pretty cool to see. But it is, again, it's the slow method to a revolution, right?
Yeah, no, everybody who's in this fight, in this advocacy, have experienced this, not even if not directly, indirectly, right? And if as long as we talk about these stories over and over again, we have to, because it's still an uphill battle from here. Let's talk about the families, though, the children who have parents willing to try an out-of-the-box treatment, like treatments that are incredibly fortunate for people, right? Because, you know, for the majority of the population, ketogenic metabolic therapies are not standard care, like we said. And I only say this because some families have to go against their doctor's advice sometimes, right? And be resourceful to find alternative ways to save their child, essentially. What has been your experience with families dealing with this?
Yeah, so it is families who have drive that come to keto. And I have to say, out of the hundreds of families I've worked with, I can only remember one family, after meeting with them for the first time and telling them what this would be about, one family that declined the opportunity. And they just said, we've got 4 kids, we both work full time, we cannot see ourselves doing this, we just can't. And I supported that. I realized, you know, they didn't have family nearby, they didn't have grandparents to help them. And for them, it was just a matter of logistics. They could not make a special meal for this child that had epilepsy. And it was sad, but one out of hundreds of people that I worked with who just said, I don't think I can do that. And, you know, the other thing is we have a lot more flexibility in ketogenic diets than we did back when I talked to that family, which is probably 20 years ago. We can do something quite simple, and we can do what we call precision keto. I grew up learning precision keto, so that's my go-to because I know it works and it works early. A lot of people find that just too much difficulty because you're weighing every morsel of food that you're eating. It's a lot of work. I start people sometimes on a really simplistic method of just cutting out fruit completely, only eating vegetables that grow above the ground. That's an easy way to remember, like what potatoes grow below the ground and turnips grow below the ground and sweet potatoes grow below. Those are starchy vegetables. We do the ones, usually the leafy greens. So, you know, something very simple like that, or just go to the grocery store, go to the vegetable department and go to the meat counter in the fat aisle where you'll get olive oil and focus on those foods and don't even give them measurements and don't, you know, lay on any more restrictive. So that's a place for a lot of people to start. An even simpler method, if I back up even more, for somebody who really is desperate and has a hard time getting up in the morning and putting on a change of clothes is just to eat protein foods, meat, fish, poultry, eggs, right? Just eat that for a few days until you start to feel better. And then you'll feel more like learning because you can get up in the morning and feel bright and alert. So that's a very crude but easy method that people like myself have used for folks that are like, you know what, I just can't do this. I can't even think straight. So, an experienced professional will meet somebody where they're at to get them going and then work on modifying their diet, getting them, a little healthier options, and then working out the bugs and trying to get them going on a path that's tolerable and livable and works for them, and give them the right words to say when they're faced with friends who want to give them just a little bit of chocolate, or just a little bit of this, right? Treat yourself. So how to deal with that kind of stuff, and we role play.
That's huge.
To work that out.
That's hard. That's hard because some people might view that as restricting your child, and I've certainly been accused of that by my own parents, right? Because my 2-year-old, she flares up. She has eczema and flares up whenever she had too many sweets. And I will tell them that she does flare up. And some of them, my mom and my dad, they really don't grasp that because they'd rather, get her to the doctor and the doctor advising cream. And for us, it's been really effective. The diet has been really effective for that. And they don't understand, no matter how much I explain it, which is very sad. It's a sad truth. But it's a world that we navigate now. And it's great that, teach parents how to deal with that as well.
Yeah, grandparents are often the biggest sabotagers of diet.
Aren't they?
Because they don't get it. Yeah. And for epilepsy, there's a direct horrible result if they get into a piece of candy, for example. So then, then grandparents see that and they understand. Yeah. But if they haven't seen a seizure, or if they haven't seen a bad behavior, or if they don't get the connection between what someone's putting in their mouth and a rash, they just don't buy it because they don't make the connection. So they're the ones that are usually harder to convince because they like to spoil their grandkids. Who doesn't? I mean, I have a grandkid and I want to do everything for her. Yeah. But I do advise her parents on you've got a sponge here, her brain is open to anything. Yeah. You should start feeding her right now. Right. Giving her candy at age 1 is going to spoil her, and she's going to want candy whenever, and you can make those changes early in their life.
Yes, absolutely. And I want to be able to help families right now. Maybe they come across this recording and looking for alternative ways. Just how effective is the ketogenic diet in treating epilepsy? And what are some of the factors that come into play, assuming 100% compliance?
Yeah, the factors that come into play, well, it's a lifestyle change for a family for sure. I just feel like I have to bring grandparents back in because I've had many grandparents who come in and actually make meals for their grandkids as a gift to the family. That's like the best thing that they can do, because oftentimes the foods that the child is eating on keto are different from what the family's eating. And I try to tell people, try to keep at least the protein. If you're having fish for dinner, the keto kid can have fish. If you're having chicken, they can have chicken. So the protein can be the same and the vegetable can be the same. The keto kid just gets a lot more fat. That's the main difference. And so that's one thing. But also to know for epilepsy, it's a temporary diet. They're on a very strict version of keto for about a year, and then we try to wean down the fat, give them a little bit more carb, a little more protein. We try and test that out. And if that goes well, we keep weaning. So they're usually on the diet 2 to 3 years. So if you know this and oh my gosh, we could do this for 2 or 3 years, not so hard. I do want to mention kids with autism because I've had a lot of kids who have both epilepsy and autism. And many times the autism gets significantly better. I've even had a couple kids where the seizures didn't change, but the autism got so much better that they remained on keto for their autism. I have a couple kids who were nonverbal, who started talking once they got on keto, that's like a miracle in itself. So it's a powerful energy metabolism change in the brain. And we also know the brain is very connected to the gut. So this now refers back to a well-balanced keto diet. What you feed your gut is important for your entire body. But this is where our neurotransmitters, most of them are made in the gut. So when we talk about a healthy diet, we talk about what's good for your gut. Plant foods, vegetables that grow above the ground, right? Not processed foods, not sugar substitutes.
Yeah.
And when you get out in the keto world, you see all these advertisements for keto foods that are candy or puddings or beverages or whatever. And I tell people, limit those. I don't even recommend. I don't eat them. I don't advise anyone else to eat them. I've taken people off of them and gotten better seizure control because we usually get better ketosis. But it all goes back to, food is medicine, and you have to think of food as medicine instead of just something to satisfy our appetite and our taste. We got to get beyond that, and that's what the majority of Americans are, just feeding their face and feeding their appetites because they don't know that connection, that it completely affects the garden in their gut and then how their brain functions.
And there's no medication that provide that type of outcome
There's no medication. Yes. There's no medication that is as effective as keto or epilepsy. And I've heard doctors say this in meetings. This is not coming from Beth. This is what doctors say. Because medications don't have a multitude of effects like keto does. Medications usually do perform one function.
So, families, I'm just curious for families right now, asking for them, somebody dealing with child with epilepsy and metabolic syndrome maybe face many different challenges. But in your experience, what would you say that is the biggest challenge for these families to go through? And for those who may be facing these challenging time for this time, what advice would you give them?
Yeah, so if a family has a child who has seizures and that child's seizures have not responded completely on the first medication or the second medication, it is time to start asking about keto as an option. That may mean going to a center that's not nearby. You're in Toronto, so you probably have a lot of Toronto listeners. Sick Kids Hospital in Toronto has a keto program that's been there for many years. They are experienced. And there's other centers in Canada as well that are very experienced. But children need some blood work first before you start the diet. We want to make sure that they're metabolically healthy. When you start the diet, there's a amino acid called carnitine. We want to make sure that's normal. And then maybe wean them down on one of their drugs if they're on more than one anti-seizure drug, because the drugs can perform differently on keto. They get more toxic on their drugs, and that's not just for epilepsy. That's psychiatric disorders, etc. It can be problematic, and you may need to wean down before you start the diet, specifically on a drug called Topamax or topiramate, zonisamide. Those are drugs that cause acidosis and that can get worse on keto. So those are the big starter things. So there's work to do. Many hospitals are now starting children on keto at home if they're relatively healthy and have a good support system. We used to only do this in the hospital. We did it quickly over 3 days. I work with patients virtually. So I start people gradually, like over 1 or 2 weeks, so that we do this very slowly and that there's a slow adaptation. And I guide them into avoiding what we call keto flu, which you can get easily if you're not drinking enough fluids and getting some electrolytes. So that's the other thing is, how are you going to start this? You're not going to do this when you have graduation coming up, so it's on third shift and, you don't have your family support system in place. You want to plan it for when you've got time to devote to working with the person in your family that's going on to keto. So those are the big things to think about. when you make this decision.
You talk about weaning them off the medication. We know that the ketogenic therapy for epilepsy, it's a complex process that you have to approach with guidance, right? In cases where a child is already, taking multiple medications, like you said earlier, what is the protocol for starting keto and gradually reducing that dosage for these medications?
Yeah, so there's not an agreed upon protocol. It really is the prerogative of the neurologist to make that decision. But the family input is so important because they're the ones that live with this child and can tell if there's a side effect of the medication. So a common side effect of a medication is sleepiness. A 7-year-old shouldn't need to take a nap. But if a child is taking a nap or 2 naps, that's not normal. It's the medication. So that type of medication should be weaned down, maybe not right when you start the diet, but as soon as you start seeing some benefit from the diet, it's a good idea to revisit that. It's usually at the 1-month appointment. We recommend that families come back into clinic at 1 month after starting the diet. Babies need to come in sooner, but older children coming in at 1 month and seeing the doctor, or a lot of places are doing virtual checkups, which is fine too. That works as well. That's a lot more common now since COVID to have virtual appointments after you have been in person with that physician team the first time. So yeah, that's when the discussion should come up. And again, from experience, I know it's the family that is asking for it. Usually the doctor's not going to say, well, let's start moving one of these medications down a little bit. No, that's not what usually happens. It's usually the family saying, I want the child to be brighter during the day so they don't fall asleep at school. Can we start weaning down on the Depakote, the valproic acid, which is commonly used in pediatric epilepsy? And I think that they're sleepier now that they're on the diet, and it's not the diet, okay? It's the combination of the diet with the drug. So can we start marching down on the dose of this drug? And usually the doctor will go along with it because he trusts, he has a relationship with the family and trusts their observations. And I don't usually hear of doctors saying no to that.
Let's talk about other applications now with the growing popularity of the ketogenic diet. What other disorders have you worked on in terms of ketogenic diet therapies?
Yeah, I've worked with endocrine disorders, so pre-diabetes, migraine headache, which I think is an endocrine disorder. Migraine headache is very responsive to keto, and there's all kinds of alternative treatments for migraines. I know people that do Botox and vitamin D and vitamin C and meditation therapy. That's all great. I have found from the people that I've worked with and family members who I've advised, keto is pretty darn effective because it's anti-inflammatory. And migraines are caused by inflammation of your blood vessels. So it makes a lot of sense, right? I've worked with people with glioblastoma brain tumors, which are very deadly, in preventing the return of those glioblastomas because they typically grow back. I've worked with adults with Parkinson's, Alzheimer's disease, what else? Other neurological, genetic, metabolic, neurological disorders. There's many. And we know that keto can be very effective for glucose 1 transporter deficiency. That's the top one that we know it's so effective for. PDH, there's a whole list of them. And let's see what else. Psychiatric disorders I mentioned. A lot of adults with epilepsy that I work with have depression and anxiety. And I don't talk a lot about that getting better because we're focusing on the epilepsy. But I love when they tell me, I'm feeling pretty good.
Yeah.
I'm gonna go out this weekend. So it's great to hear them self-report without me pumping them.
Yeah, I can attest to that. Yeah, because I couldn't even get out of the house without, when that happened to me, I was so fearful to get out of the house. And then once I was on the ketogenic diet, everything went away. It was amazing.
Yeah, and that is so common.
Keto is a big hammer.
It is. And for people that are thinking, I'm not going to do keto, it sounds so hard. you know what? Just getting sugar out of the diet and highly processed foods, just eating real foods
Yeah.
can make a difference there. It's not going to give you the big high that you get from keto, but it can make a big difference in your
Yeah.
energy level and how you feel and your anxiety. So I've seen that as well.
Yeah. It's good to know that it also works for glioblastoma, because I've had an experience with that with a family member, and it was unfortunate. But what's the effectiveness for that? Just curious.
Yeah, I don't know the statistics because it's so hard to do studies
Mhm.
on glio, large populations, because it is such a devastating cancer. Usually when people are diagnosed, they're given a life expectancy of a year and a half. That's how devastating this is. So the studies that have been done use keto alongside of standard of care, which is chemotherapy and
Yeah.
sometimes radiation, if they can do radiation. But the anecdotal evidence, which is case studies or just anecdotal, shows that it does extend life. Now, I have to say, the people that I've worked with, and I've probably worked with a dozen people that were diagnosed, in all cases, they've lived beyond the 18 months. In all cases, their tumors came back when they went off keto, or if they kind of lightened up and started eating quite a bit more carb. So yeah, so we still are, not on a clear pathway, but it certainly is better than 18 months.
Yeah.
You can live longer. And I had a guy that I followed for 8 years.
Yeah.
Kind of lost track of him. I just stopped
Same.
working with him because he was. Yeah.
I know somebody who has survived 9 years. Right now, he's still living strong on a ketogenic diet.
Yeah.
Yeah.
That's great. It's great to get those stories out.
Yeah.
Because it's a horrible cancer.
Well, Beth, thank you so much for coming on. I want our listeners here to be able to connect with you, and maybe they know somebody who needs support, families need support, where they can find the treatment on how to deal with, epilepsy and metabolic syndrome. Where can they find you?
Yeah, I do have a website. It's just my name, BethZupec-Kania.com. And I'm going to give my Charlie Foundation email address because I have 6 different email addresses, but this is the one that I keep all of these kinds of contacts in. And that's simple, BethZK@charliefoundation.org.
We'll link everything down below so you guys can check that out. Beth, thank you so much for coming on and sharing your story with us here. We've learned a lot from you, and we'll continue to follow your journey and support your advocacy. So thank you so much.
Thank you, Lawrence, for interviewing me.
All right, Beth. Awesome.